Hello, Dr. Lewerenz here, Longevity Health Institute. Hey, let's talk about something that's really big and impactful going on right now. And I know you've heard about it is because we're in 2021, but what was huge in 2020 is this COVID-19, right? It's a big deal right now still, but a big deal in the sense of post-COVID reactions, post-cytokine storm reactions, okay? Yes, granted, this may not be everyone out there and may not be a lot of my patients out there. So this is probably some of new people listening, okay? So please share this. If you're my follower, subscriber, you're my patient, me or my practitioners here at Longevity Health Institute, it may not be you. This may not apply to you, but there's probably people out there that you know or people that have been afflicted with COVID-19 and it hit them hard. I mean, it hit them really hard. And yeah, you might not appreciate it or really understand why, or like, wow, that's weird. It didn't happen to me, to date, we've had hundreds of cases here that we've treated and treated very efficaciously, very smoothly and well. And we've had very few hospitalizations, and we've had literally one on event. And to date that we know of, zero mortality here at Longevity Health Institute. But here's why, and I'm going to tell you why, and it's big. And listen, post-COVID inflammation, post-COVID cytokine reactions, okay, and are real. They're very real. Saw one here today. I'm going to go over it with you. This patient actually, obviously not going to share names and all that, but I want to give you, her demographics and her age and kind of her history. And it's really key because it's very common. And a common thing that I'm about to share with you is about something that tons of you, millions of you out there have, okay, and think it's nothing, okay? And that is your gut health, okay? And we're not just talking Mickey Mouse stuff with your gut and digestive health. We're talking about if you have a digestive issue, you have to first appreciate it. You only know what you know. And I'm telling you, if you expect to have heartburn, bloating, reflux, esophagitis, esophagitis, heartburn, ulcers, IBS, yeah, I said it 3 times because it's so common. Millions in America are afflicted with these things and think it's nothing and they take a Band-Aid for it. How about fix it? You know why? Because it'll save your life, besides help your immunity overall. So let me tell you about this patient, but I want to preface this with a study that just came out that was reported literally in, I have to cheat here because I read so many journals, can't remember which journal, but the Journal of Family Practice News, okay, which is sponsored by the American Medical Association, but Family Practice News here, okay, and that is a study that came out that they're looking further into a link between medication, actually PPIs, so medications that block acid in your gut. So for people with heartburn, reflux, gastroesophageal reflux and esophagitis and ulcers and things like this, okay? And they're over the counter. So by the way, you can go get them anywhere because why? You got a little heartburn or whatever and you go get your Prevacid or Prilosec or omeprazole over the counter, okay? And all of these are doing is shutting down acid pumps in your gut that is not necessarily good for you, yet you get symptom relief. So I called them Band-Aids, okay? And you're masking the problem. Well, this study that just came out that was literally just last month published says that they're going to further investigate the link between mortality, death, hospitalizations, and COVID-19, okay, because there is a study that's showing at least a 24% increase in mortality and hospitalizations in people that were on PPIs. Well, hello, it's not the PPI, it's the gut health. These people are taking a Band-Aid for a digestive issue, okay, a digestive lining issue that is your immunity. And you have to have a good immune system, a good innate immune system that is where? In your gut lining. So not just your gut flora, not just probiotics, but literally your gut lining, okay, the barrier, okay? So what's the biggest organ in your body? This is a tough question. It's tricky, kind of tricking you here. It's your skin. But I want to give you an analogy. Why is your skin the biggest organ and so important? It's your barrier. It's your protective barrier. It's literally the biggest organ in your body is your skin. Your gut lining is very, very close as far as your biggest organ, and it is a barrier that is a protective barrier, okay? There is an antigen-antibody reaction, meaning you get a big immune inflammatory reaction when you have a digestive problem, okay? Even if it's just simple, okay? Not this patient that's 57, female, new today that I'm gonna share with you, but give you another quick shared thing is a gentleman I saw today, I hadn't seen in a few years, patient of ours, but just, kind of has been well, did a live blood on him and actually showed that he had a lot of yeast. And what does he say? Well, my wife does say I go, I clear my throat a lot. My wife does say I choke on food sometimes, and I on and off complain of a little bit of throat burn or throat heartburn. And I'm like, yeah, well, time out. That's not normal. Thus, he has a digestive issue that we found today, kind of minor in him, but we will tackle it early, being proactive, not reactive, and fix it, okay? So let's get to this case. This patient is 57-year-old, new patient, female, okay? 0 medications she took prior to her COVID-19. Say that again, 0. Her only history was that when she was older, excuse me, she's older now. When she was younger, okay, and I'm not distracted, I just have to reflect on my notes here. When she was younger, she did take a lot of antibiotics for respiratory sinus stuff for the first 4 or 5 years of her life, okay? And yes, her mother has bad digestive health. So a lot of her digestive journey started when she was younger. Now, she lived with being diagnosed in her 20s and in late 20s and on with fibromyalgia, never taken medication for it, just natural things and, pain medications like Tylenol and that. But also the only other history, never hospitalized or anything like that, again, for 57 years was this antibiotic use when she was younger, okay? And she had a little bit of IBS, didn't go to the bathroom every day, never thought it was any big deal. But again, that was her history. Literally, that is her history, okay? 57-year-old female, okay? Now, she does admit to prior to COVID-19, she had some stress. She, wasn't sleeping great. She is postmenopausal, said, well, I get a little hot flash or whatever. But again, in her world, nothing big. Her son's 21, brings home COVID-19. He's sick for 2 days. Her husband picks it up. He has it for about 4 or 5 days, and it resolves pretty easily. And he's 62. She's 57, okay? She is sick horribly, respiratory-wise, GI-wise, sinus, fever, etc., okay, for 2 weeks. Gets hospitalized because of how sick she was, develops COVID-19 pneumonia, okay? Thank God not put on a vent and got hypoxic like that. This causes a big inflammatory storm in her, this cytokine storm you heard about the last year with COVID-19, develops pancreatitis, gets worse because of steroids and medication she's using and finds out and develops an ulcer, okay? She was hospitalized for about a week and a couple different visits to hospitals after that, and a bunch of specialists and tons of blood work, etc. And for just time, I'm going to speed this up a bit, okay? But is really hit majorly hard post-COVID. So she gets home, the respiratory stuff calmed down in that, but has now major brain fog, major fatigue, literally stopped working, and really started losing hair, rapid weight loss, lost about 25 pounds, chronic nausea, saw a cardiologist after because she was having all these palpitations, and obviously the GI doctor that had to scope her, and she has an ulcer, and this just became this snowball of a poor health cycle, okay? Why? Well, we learned today, and I educated today about the importance of gut health amongst and many other things, okay? She brought all her labs in and we dug deep and spent about an hour plus on her, okay? But she had a horrible gut, okay? And she didn't appreciate it. Her IBS, her fibromyalgia was linked to that, taking a lot of antibiotics in the past. Yeah, she kind of dealt with it, and to her it was small, but it is her immune system. It is her innate immune system, okay? And your innate immune system is your most important, strongest immune system that you have and that God gives you and your mother gives you. And if it's not taken care of, things like COVID-19 and that will hit you a lot harder, okay? So this is super important, and it's why she was affected so bad with it. Now, she's coming out of it a little bit. Again, when did this, I didn't think I mentioned this, when did this happen? She started this in November. Here we're mid-March, and she's still having difficulty. Still has fatigue, still has brain fog, not sleeping good, hair loss, and occasionally chest palpitations, and tons of anxiety. Now, some of her anxiety is because she's been sick and, obviously worried, and why can't she get better, and not a lot of answers with all these specialists, but also, she's not sleeping, and, what the heck's going on, okay? So her goals are literally, hey, help my brain because this brain fog is horrible, and help my energy and get me out of this anxiety, and obviously help my gut because I have an ulcer and they got me on these meds. So of course we are. But I want to tell you some things we discovered here on her first visit in the office, and we will get her better and get her in the right direction ASAP right away. But we did a mini mental test on her, which is a standard for brain screening and cognitive screening. And her mini mental exam was literally on the border of what we cut off and have to dig deeper in for dementia or mild cognitive impairment. Okay, real cognitive issues. Okay, now I think we're going to resolve this with some things, okay, and I'll tell you why. But her mini mental score was 26 out of 30, and you can look that up out there, but a mini mental score that low ain't good, period. Nothing good about that, okay? But we're going to fix her, okay? We're going to get her on the right path. Now, why is that? I think she has a lot of, cerebral neurologic inflammation. I really do believe it. She has in her blood a D-dimer that's 900, a CRP that was over 5. They discovered some other inflammatory things in her and immune things like maybe autoimmune and not autoimmune and things like this, okay? And we're gonna have to do our own labs and dig deeper, okay? And then we did her live blood, and she had horrible yeast. You've heard me talk about this in other videos when I talk about leaky gut and digestive issues. Tons of yeast in her blood, a compromised digestive barrier. And what does that mean? That means bad immunity. So she gets hit way harder and has much bigger cytokine storm and an immune reaction in her body. So obviously we got to hit her with some things that are really going to help her from a healing standpoint, but really dive deep into gut health and healing that barrier. It's all about your digestive barrier. Of course, probiotics and gut flora and these trillions of good bacteria are important, and that homeostasis there. But what's the most important is the boundary, is the border, is the digestive lining, okay? So that's super, super important, and studies are showing it here with COVID-19. Now, can we reverse this? Absolutely, absolutely. It's gonna take some work, but absolutely we can reverse it. And what I'm gonna do is track her, and you can watch other videos, okay, on this, on our WAVI test and cognitive test, because she's going to come back and we're going to do a WAVI EEG test that has good software that will show very good metrics of our brain speed and voltage, and then we can compare that in about 6 months or even a year if needed, so we can recover her brain health and memory literally back to normal, potentially even back to better than she's been before. But the key thing is here, and for you to take home and understand, is you can't expect good immunity with poor digestive health, poor diet, poor gut health, okay? That's it in a nutshell and brief on a great case where we can really help somebody. And yes, we have many protocols to prevent COVID-19, and we have protocols to actually help this inflammation and cytokine post-COVID-19 storm. A lot of those are basically using tons of antioxidants in things that are healers and regenerators, just like, we'll use for her, because we're about regenerative medicine. There's not just one thing, but everything's personalized, so a lot to go over just here. But remember, prevention is key, okay? Preventative, proactive medicine is key, not reactive medicine. We can prevent, okay? And we can reverse brain fog and post-inflammatory COVID-19 type of things like this, okay? And if you know of others, please share this video with them. We do see new patients, we do telemedicine, and we have other practitioners here, and lately been seeing people around the country to really help them along this health path that is pretty easy to get and capture, but you gotta understand it, and you only know what you know, okay? And if you learn more, then you can do better, bottom line, right? So hopefully that hits home and you share this with others, and if it's you, we're here for you. But this is Dr. Lewerenz, Longevity Health Institute in Rochester Hills, Michigan, as other locations. Hit us up on the web, send us an email. Our website is longevityhealthinstituteinc.com, and give us a call if you need, 248-548-3060 or 248-289-6643. This is Dr. Lewerenz. Be well, and hopefully this educates you a bit. Be well. Have a great night.